Hello and welcome. Today, we'll explore LO1, understanding how different psychological perspectives approach the treatment of mental illnesses. In this session, we'll see how each perspective offers unique ideas and methods to help understand and treat mental disorders. The biological perspective attributes mental illness to biological factors. It focuses on neurotransmitter imbalances, genetics, and brain structure. Treatments include medications like antidepressants and antipsychotics. Electroconvulsive therapy is also used in severe cases. While effective, this approach may overlook psychological causes. The behavioral perspective sees mental illness as learned behavior. It uses conditioning to unlearn maladaptive behaviors. Techniques like systematic desensitization and exposure therapy are common. This approach is practical, but may ignore underlying thoughts. It is effective for phobias and anxiety disorders. The cognitive perspective links mental illness to distorted thinking. Cognitive behavioral therapy is a key treatment method. It helps individuals challenge negative thought patterns. This approach is evidence-based and effective for depression. However, it requires active participation and may overlook unconscious factors. The psychodynamic perspective focuses on unconscious conflicts. It explores childhood experiences and emotional patterns. Techniques like dream analysis and free association are used. This approach provides deep insight, but is time-consuming. It is less supported by scientific evidence compared to CBT. The humanistic perspective emphasizes self-concept and personal growth. It uses person-centered therapy to foster self-acceptance. Therapists offer empathy and unconditional positive regard. This approach builds a strong therapeutic alliance. While client-focused, it may lack structure for severe disorders. Different perspectives focus on various aspects of mental illness. Biological approaches use medication for severe disorders. Behavioral methods address learned behaviors. Cognitive therapy targets thought patterns. Psychodynamic therapy explores unconscious conflicts. Humanistic therapy enhances self-concept and personal growth. Modern treatment often combines multiple perspectives. This is known as the biopsychosocial approach. It integrates biological, psychological, and social factors. For example, medication and CBT may be used together. This holistic model is considered the most effective today. The biological approach has a strong scientific basis. Medications can quickly reduce symptoms. However, they may not address underlying causes. Side effects and relapse risks are concerns. This approach may overlook psychological and social factors. Behavioral treatments are practical and evidence-based. They are effective for anxiety and phobias. However, they focus only on observable behavior. This can limit their effectiveness for complex disorders. Thoughts and emotions may be overlooked. Correct. Cognitive behavioral therapy is widely recommended. It is structured, time-limited, and cost-effective. However, it requires active participation. It may not suit severe psychosis cases. Critics argue it focuses too much on conscious thought. Psychodynamic therapy offers deep emotional insight. It explores long-standing behavior patterns. However, it is lengthy and expensive. Evidence of its effectiveness is less consistent. It may not be practical in public health care. Humanistic therapy emphasizes empathy and acceptance. It promotes self-esteem and personal growth. However, it is less structured. It may not be sufficient for severe mental illness. Measurable treatment goals can be lacking. Major depressive disorder is a common mental illness. Different perspectives offer various treatments. The biological approach uses medication. The behavioral approach involves behavioral activation. Cognitive therapy addresses negative thought patterns. From a biological view, Depression links to neurotransmitter imbalances. Treatment involves medication like SSRIs. Severe cases may require hospital support. The aim is symptom reduction through brain chemistry. Monitoring and dosage adjustment are essential. The behavioral view sees depression as reduced positive reinforcement. Treatment involves behavioral activation. Gradual reintroduction of activities is encouraged. A therapist helps create an activity schedule. Positive experiences aim to improve mood over time. The cognitive view links depression to negative thoughts. Cognitive behavioral therapy is key. It helps challenge and change thought patterns. Therapists use evidence-based questioning. Thought records and homework tasks reinforce new patterns. This is the conclusion of the video. Each psychological perspective offers unique insights into mental illness treatment. Combining these approaches often yields the best results. Understanding diverse methods allows for comprehensive and effective mental health care. If you have questions, message us on WhatsApp at 07484361688. See you at the next session. Thank you for your attention.